Hello everyone, myself Vivek Devani and my topic is clinical features and management of frozen shoulder. So first of all, what is frozen shoulder? It is defined as a clinical syndrome characterized by painful active or passive shoulder movements due to causes within the shoulder joint or other parts of the body. It is also known as humeroscapular periarthritis or the adhesive capsulitis. So first let's see the clinical features of the frozen shoulder. So we will discuss the clinical features of the frozen shoulder as a part of positive findings for the frozen shoulder. So the first, who are the one to acquire it most commonly? So the women and the labor workers who have a high chance to acquire it because of their daily living activities of the overhead activities which they perform frequently in the daily life, and other who are suffering from diabetes mellitus are at high chance to acquire it. And the most common age to acquire is the 30 to 45 years old. So the next clinical features can be decrease in both active and passive range of motion. Also, the patient complains of more severe pain at the night time. Patient will complain in a way that while the patient is trying to sleep on the sideline on the affected side, the pain suddenly increases more and give a throbbing kind of pain. Also, patient may show a capsular pattern of external rotation affected more than the abduction affected more than the internal rotation. We can also say that while we try to stretch the shoulder joint, the patient complains of pain. Also, during the gait assessment, we can see that there is absence of the arm swing on the affected side. Also, the SSL joint play will be reduced for the affected side, and also patient have some complaints such as having difficulty while buttoning the shirt, while scratching the back, or while keeping or taking any kind of object or thing from the back pocket. So we can also discuss the clinical presentations according to the clinical stages of the frozen shoulder. So there are basically 3 stages of the frozen shoulder. So the first stage is the freezing stage, which is also known as the stage of pain. So generally in stage of pain it remains for 10 to 36 weeks, and in this the pain will be severe and pain will be more at night time, and there will also presence of stiffness, and the drugs such as NSAID will not much work effectively in this phase. Next stage will be the stage of stiffness, which will be also known as the stage of adhesion. In this generally this phase remain for 4 to 12 weeks, and in this stage the pain will gradually decrease but the stiffness will remain the same, and we can also say that the range of motion will start to decrease and external rotation will be totally absent in this phase. Next will be the stage of recovery, which will be also known as the stage of restoration. This generally lasts for 10 to 40 weeks, and in this stage the pain will be totally absent, the stiffness will gradually decrease, and there will be improvements in the range of motion. So now let's discuss the management for the frozen shoulder. So the management of the frozen shoulder is divided into 3 phases. So the first stage is the protective phase. So in the protective phase, we can say that first thing to do is to control the pain, edema and the muscle guarding. So to do that, the joint is immobilized in a sling to provide adequate rest and minimize the pain. Next is to minimize the adhesion formation. So to do that, we can start with the intermittent period of passive range of motion exercises in the pain-free range, and gradually we can shift to the active or active assisted range of motion exercises. Next is to maintain the soft tissue and joint integrity and mobility. So to do that, we can progress from passive range of motion exercises to the active range of motion exercises in pain-free range, generally with or without assistance. With assistance in a way that we can give a ball to the patient and tell him to drag it on a smooth table, or sliding a rag on a smooth table in the direction of flexion, abduction or the circular motion. We can also start with the joint mobilization of grade 1 or 2 for pain relief. We can give in any of the glides such as caudal glide, anterior glide or the posterior glide to relieve pain in the particular motion. Next, we can start with the pendulum or the cordman exercises. Generally, it is done with the effect of gravity to distract the humerus, head of the humerus from the glenoid fossa. Generally, we perform the exercise in the manner like putting one hand on a table and leaning forward, and then moving the affected hand freely from the shoulder and extended from the elbow in forward and backward direction, and in inward and outward direction, and also in the circulatory motion. But in this stage, we will not provide any of the weight in the hand to the patient while the pendulum exercises. Next are the isosetting exercises. In the isosetting exercises, they are generally performed to contract the muscle. But here we will tell patient to contract the muscle for only of 5 to 10% of force, as it are the isosetting exercises. So it is generally done just to provide the adequate blood supply to the muscle group, and it will be performed for all the muscle groups surrounding the elbow, surrounding the shoulder joint, such as the for the scapular muscles also. It is generally done for just to avoid the circulatory stresses. Next are the reflex sympathetic dystrophy. It is the most common complication, so particular attention is given to this complication. We can add exercise such as squeezing the ball or the soft objects. The next phase in the management of the frozen shoulder is the controlled motion phase. Controlled motion phase. So in this phase, the first thing to do is to improve the range of motion. So to improve the range of motion, it is said that in this phase, on each and every day, progressively the range of motion should increase. Like on each and every day, we should see some or the other improvement in the ranges. So for that, we should teach some of the self-active assisted range of motion exercises to the patient, such as the bend exercises, sliding hand on the table exercises, shoulder pulley or shoulder ladder exercise, finger ladder exercises, or the shoulder wheel exercises. All the exercises should be performed by the patient actively on the daily basis. Next is to progressively increase the joint and soft tissue mobility. So for that, the stretching maneuver should be started. So for all the restricted ranges, passive end range stretches should be started on the daily basis, and also the self stretches should be taught to the patient by the therapist to perform at the home. We can start with the 50 to 60 second hold for 3 to 5 repetitions for all the restricted ranges. We can also start with the mobilization of grade 3 or 4 to increase the range. We can give all the glides such as the caudal glide, anterior glide, or the posterior glide to increase the motion of flexion, extension, abduction, internal rotation, or the external rotation. Next, we can start with the pendulum exercises. In this phase, the pendulum exercises are generally start with the weight. We should add weight of 200 to 500 gram with the help of any kind of sandbag, weight cuff near the wrist region, or with the help of a dumbbell. Next, we should start with the increasing in the muscle strength. So to do that, we should go from isosetting exercises to the isometric exercises to slowly increase the strength of the muscles. The last and the third stage in the management of the frozen shoulder is the return to the functional phase. So in this phase, the thing which we need to do is to progress to the more flexibility and more strength. So for that, the patient should start with the stretching and strengthening exercises with very high progression as per tolerated by the patient. But in this stage, all the stretching and strengthening exercises should be performed by the patient in totally actively without any kind of assistance. So we can say that all the range of motions are near normally recovered in this stage. So the patient can perform all the activities and all the exercises by totally actively. But if still in this phase any kind of capsular tightness is still present, there is need of vigorous stretching and vigorous mobilization techniques to relax the capsule and increase the mobility of the joint. And the therapist should plan the further treatment for the therapist in such a way that it replicates the functional activity of daily living of the patient.
So these all are my references for the video. Thank you all for listening me.